And speaking of doctors and medical procedures, Dr. Kevin Kavanagh is a retired physician, and he is also founder of a international organization called Health Watch USA. He joins us now. Good morning, Dr. K.
Good morning, Jack.
Hey, Fauci on the TV over the weekend has gotten people all, their hearts all aflutter. Tell us what Fauci said.
Well, he kind of confirmed what we were saying a couple weeks ago, Jack, is that U.S. cases may have an uptick. And that is something people need to realize. It's why I said we still should be wearing masks in indoor places. It doesn't mean this is going to be a severe surge, doesn't mean people are going to get severely sick. That just isn't known. But this is a virus that is still deadly to a lot of people if you're immunocompromised or if you're at high risk, and it certainly can cause problems such as long COVID. So it's something you want to avoid if you can. And when I look at the stats for Kentucky, we're still the worst area in the nation. In fact, Pulaski County, according to New York Times data, has the highest rate of COVID-19 cases practically in the entire nation. There are 3 other counties which are worse, and those are in Texas, and they have populations of, well, one's under 10,000 and the other 2 are under 4,000. So we're not exactly doing real well in all areas. And with the BA2 variant, I fear that we may be in for another uptick in cases. And because of that, let's be safe and let's try to respect others that have compromised immunities and may be very, very susceptible to this virus.
Fauci said particularly concerning was this, is it BA.2? Is that what it's called? The subvariant? Yeah. And that it's apparently the severity of illness is much lower than Omicron, but it's very, very even more contagious. Is that right?
Yeah, some estimates are it's as contagious, if not more, than measles, which is the most contagious virus that we have. And of course, when you think about severity of illness, that's almost become a meaningless term for the individual because everybody's immunity now is so different. Very few people haven't had at least some exposure to the virus. Some have had recent exposure. Some are exposed to different variants. And then you have the vaccine, which is to the old Wuhan variant. And of course, people can have 1, 2, 3, and if you're severely immunosuppressed, even 4 doses of the mRNA vaccine. So it's hard to tell individually what your risk is. But overall, I don't suspect we're going to have a surge of cases worse than Delta. But Jack, as you know, it's very hard to predict what's going to happen with this virus.
One more thing before we have to let you go, but hospitals asking patients to remove their N95 masks, what's that about?
Yes, that's kind of crazy, but unfortunately it's happening. There are some hospitals around the nation, and this isn't in Kentucky, let me stress that if a patient were to come in with an N95 mask, they'd ask them to remove it and they would give them a surgical mask, which probably with Omicron and with this new variant isn't going to give them as good a protection. It really, to me, doesn't make much sense. One of the hospitals they talked about was Massachusetts General Hospital, which actually was the hospital of the CDC director before she left and went to the CDC. So I think that there's a lot of miscommunication out there. When you're in the hospital, there's a lot of sick people, a lot of people coming in are immunocompromised, and they need to have the maximum protection, not a downgraded, watered down type of protection. So I think that's an error and patients shouldn't do that. And as we spoke before, go out and get N95 masks. That is just key.
All right, Dr. Kevin Kavanagh, thank you, sir.
Thank you, Jack.